Thank you, Convener. I'd like to go back to some questions that colleagues have posed regarding their areas, and it's regarding the documentation that was published this week on the 25th of October. It's on Table A, the indicators, signals and levels for each local authority. Like Shona Robertson, who asked some questions about Dundee, I'm going to ask a couple of questions about Inverclyde. Looking at that table, Inverclyde is certainly lower than any other local authority area in the West Coast within the NHS Greater Glasgow and Clyde Health Board area. But as has been widely anticipated, that we will come under Tier 3 as compared to potentially Tier 2. And looking at this indicator table, the hospital forecast seems to be the key driver in any type of, or in any decision for any tiering position. Is that the case?
I think I should ask Jason to answer that, given his knowledge of the background to this and the decisions being made on the tiering, as well as the wider national question, and I suspect it's a balance between the two.
It is precisely that. The gearing of the levels is not science. You can't publish a threshold and say this is the only thing that matters and this is how you become a 2 or a 3. That would be completely artificial, and it would remove the ability for judgment from local public health teams. You of course have to take into account, as I've described, I think, for Lanarkshire, what you would do around ICU capacity, around health service capacity, because the last thing we want is a fast outbreak in Inverclyde that we then can't cope with in our hospitals to protect the residents and citizens of Inverclyde. I think Inverclyde is different from the rest of the West. I think you're absolutely right, and the data has been relatively consistent now to suggest that Inverclyde took a really big hit in Wave 1, but hasn't taken such a big hit, to use shorthand, in Wave 2. We don't know why. And it's a very interesting research question about what is different about Inverclyde. We're seeing a similar phenomenon in London, where London is slower and less affected in a second wave than the north of England. And there are questions in there that researchers are presently asking about what that is. Is it a level of immunity? Is it behaviours? Is it? We simply don't know yet. The other challenge, apart from hospitals, is time at that level. So we're still concerned locally, the local public health leader in Glasgow and Clyde, but also nationally, that it's too early for that central belt to move downwards. And we're facing exactly the same challenge on the East Coast in the conversations with Edinburgh City and East Lothian, who feel they are in a similar position to Inverclyde. So Inverclyde will be, not to prejudge, will either be a 3 or a high 2, if you see what I mean. So it may be that Inverclyde will move down over time faster than some of the other local authorities, and it won't just be dependent on ICU capacity and hospital capacity. It will also depend on their individual preference.
No, thank you for that. Because certainly, when you look at the data that has been presented, and Inverclyde's position, and you touched upon that there yourself, Jason, regarding where Inverclyde has been, also where it was in phase 1, and also where things have over the last number of months. I would suggest that how the population dealt with phase 1 has certainly helped with the situation that we've had consistently for a number of months. I think there was an initial fear because of where Inverclyde was with phase 1. But I think people certainly took on board the rules, the regulations, and followed the facts and followed the guidance, because they didn't want that to happen again. Clearly, too many friends and family of individuals succumbed to COVID-19, and people don't want that to happen again. Sorry.
No, I was simply going to agree with you and add one thing that I perhaps should have said. that's important. I understand that it's very, very important to get the first sets of levels correct, but those levels are not forever. So the public health advice will be, we will review this every week, and we will advise local authorities should be moved, probably not quicker than 3 to 4 weeks would be our instinct, because that's about an incubation period and a half of the virus. So you learn quite a lot in 3 to 4 weeks. So what happens on the 2nd of November is not fixed until March. I think it's important that the residents of Inverclyde, just like the residents of every other local authority, understand. So initial tier is not the same as tier forever.
I accept that point. What I would say, though, to challenge you on that, is that because of where Inverclyde has been over the last number of months, and following the rules, following the guidance, and with our rates being a lot lower than neighbouring local authority areas, this is something I touched upon in my contribution in the debate yesterday afternoon. I wouldn't want particularly the hospitality community in my area, feel as if they're being challenged even more so because of what's happening elsewhere, when the people within Inverclyde actually have done the right thing over the last number of months. So I also accept the point about the tiering. The tiering is extremely important, particularly on the first announcement, which obviously is going to be tomorrow.
Could I just make a point about this phrase "doing the right thing"? I'm absolutely certain that the vast majority of people try to do the right thing, and that applies to licensees, to hospitality providers, to publicans, to restaurateurs, to individual members of the public. It is not a judgmental thing, which tier you're in and which tier you're not in. It relates to the objective evidence laid against a whole range of other pieces of information, some of which, like the national position, are objective, some of which, as with some of the four harms, will be more subjective, in order to come to a judgment. And I'm sure we all get people who say, look, I've done everything properly, I've done everything right. Why am I being victimized or penalized? And the answer is, you're not being victimized or penalized. We are desperate to help in any way that we can and to support. But this is about the public benefit and the public health benefit and the essential task of suppressing the virus and saving lives. It is not a judgment upon individuals, and we shouldn't in any way talk about that. Now, there are people who have behaved irresponsibly. They're a very small number. We see that reported. But let's be accurate about how we're approaching this.
Okay, and just I've got one other question that's on a totally separate area. It's just to do with the Delegated Powers Committee in the Parliament. And I sit in that committee too. Just also with the new proposals that are going to come forward for scrutiny, do you believe that they will actually aid the Delegated Powers Committee to undertake the work it needs to undertake regarding any new regulations?
Well, there is a place for committee scrutiny within that. It is of an important place. Whether both the COVID Committee and the Delegated Powers Committee or other committees wish to be involved in that, maybe the committees could, unthinkably come together and be involved in an evidence session or consider things. The importance is to ensure that the matrix does two things. It allows and encourages the maximum scrutiny, but it also makes sure, as Jason's indicated, that delay does not take place, which is dangerous. So, within that regard, it is not for me to say which committees will be involved in which way. I think what we are trying to do is to come to something that benefits all of us, both in terms of scrutiny and in terms of effective governance.
Thank you.